Joe, you've been changing things up at Baxter over the last 2 years. You've been cutting layers of management. You've been boosting innovation. You made an acquisition. Where are you going with all of this? What do you want Baxter International to be?
Our changes are driving the company to deliver to our hospitals and homes the products and the technologies to save and sustain life of our patients. Our success is how do we deliver better health care value to the patient.
Joe, not long ago, you were talking to Wall Street analysts and you told them that Baxter is interested in doing more mergers and acquisitions. And actually, you said you have an M&A team showing you deals. What kind of businesses do you want to get into?
We like injectables. We like dialysis. We also like acute care, renal care, which is the hospital part of our business. So any company that is within our areas of business.
As you know, many hospital chains have been consolidating and many of your competitors are getting bigger through other acquisitions. How important is it these days to be a big player in healthcare?
Size alone does not provide you for better business opportunities because you still have to be the best in each one of the therapeutic areas that you have. The hospitals are in a different situation. As they consolidate, they become more efficient. There's a significant amount of overhead cost when hospitals are agglomerated in big cities or not enough hospitals in rural areas. So the merger of hospitals have a different purpose than in healthcare product companies like ours.
Let me ask it to you this way. I know you're a deal maker and you have a talent for spotting great deals. And you also have Daniel Loeb as a major shareholder in Baxter, who also happens to be a very aggressive activist investor. To what extent is he pressuring you to do something big? And then in that sense, I mean a major deal.
Dan and Third Point have been great owners of Baxter. I think what Dan wants at the end of the day is that you create value for your shareholders through different ways of doing this. It's all about allocation of capital. You can't go 100% into acquisitions. You've got to return some money to your shareholders, and the combination of both is where he's interested.
Let's talk a little bit about Obamacare. As you know, Washington lawmakers will soon be voting on some kind of a plan that will repeal parts of the Affordable Care Act to free up more money for tax cuts. How do these kinds of developments, what do they mean for a big healthcare company like Baxter?
Healthcare is about utilization and cost efficiency. So if we add more people to the system and we cover more people, you treat more people, that impact the business on a positive side, and it's good for American people, it's good for the companies, it's good for the providers. Need to be careful when we start moving money around that we don't take people who are very sick off the system and take people who have pre-existing conditions off the system, because they need to be treated. Eventually they will be treated and somebody's going to pay for it. It's just not a place that you can start moving money around. So the impact to any healthcare company is put the money behind ensuring the lives and covering what people need, so the system can provide that at a reasonable cost and efficiency.
Well, as the CEO of a major healthcare company, what would you like to see happen?
We would like to see that the healthcare being provided to as many people as we can through a reasonable cost without a lot of bureaucracy. So I think we have good insurance companies that should go across state lines. We should be able to do coverage for people in a reasonable way. So as a CEO, I would like to see the American people with the coverage that they can afford and the care that they deserve.
And let me ask you also this. As a CEO of a major healthcare company, what don't you want to see happen?
We don't want to see happening is that only the most privileged or the people who are employed by major corporations are the ones that have the best healthcare coverage. People in general, disease is not discriminatory. People need to have healthcare that is accessible and cost effective. So as a CEO, for my employees and for the people who we support, we like to see that happening.